Hello, my name is Dr. Jenny Setchell and I'm from the School of Health and Rehab Sciences at the University of Queensland, of course, and my research is generally about physiotherapy or other related health professionals and sort of where stigma, discrimination, power play out in those professions. So today I thought I'd share with you some work that I've been doing on the LGBTI community and how that goes in the context of physiotherapy. So specifically today I'm going to talk about transgender and non-binary people and bodies in the physiotherapy space. I myself identify as non-binary, so it's something that's close to my heart. I'm not transgender and haven't been through surgery or hormones, but in terms of my identity, it's non-binary or genderqueer. So it's something that I've experienced in the world to a certain extent at least. So today I'm going to focus on improving health professionals' reflexivity related to gender, so their own understanding of gender and how their work as health professionals relates to that. I'm going to look at reducing unintended assumptions, blind spots and stigma in relation to gender and physiotherapy. And particularly, but this obviously also relates to other health professionals. And I'm going to show some areas where physiotherapy, and again, other related professions, and non-binary and trans issues might meet, where they might be particularly important. My focus is not on changing trans and non-binary people's behaviours or anything in the context of healthcare professionals. So really the focus and the lens here is on the health professionals. But if you're a trans and non-binary person who's not in the context of being a health professional yourself, then you might also find some interesting things in this talk for yourself in terms of your relationships with health professionals. So really what I'm doing is placing the responsibility for addressing inequity on health professionals, not trans or non-binary people. Although considering that unfortunately we can't change the world straight away, I will provide some tips and tricks for you as trans or non-binary people to perhaps go better in this kind of imperfect world of healthcare as it is at the moment. And I won't be focusing today, although I will dip into a little bit on particular specific physiotherapy techniques that are relevant for trans and non-binary people. But again, I will mention it. So my focus is on the left and not so much on the stuff on the right. So I just want to, in case you're a trans person or a non-binary identified person, genderqueer, or however you like to term yourself, some tips for visiting physios. I'm going to get that out of the way so you can stop there if you don't want to see the rest of it. It's not your work to be done as a trans or non-binary person. So here's some quick ones for you here. You can feel marginalised in this space. That's probably no surprise to you. And certainly research shows that as well, including my own. I would, if you were going to go and see a health professional, to increase your chances of having a better experience, ask people for recommendations before you go, particularly other trans or non-binary identified people. Shift the power balance where you can, because it can be a very disempowering experience going to a health professional. For example, take a buddy or a support person, someone who's comfortable in the healthcare context, who's got your back, who can make sure that your questions and concerns are answered and that you're treated respectfully in that context. So you may want to help this, write a list of questions you want answered. This makes sure that even in this sometimes uncomfortable context, it may be about your trans or non-binary related health issues, but it may be about something else entirely, but still having a transgendered body, having a non-binary identity can come up in any type of health interaction, not surprisingly. So write a list of questions you want answered and make sure that those are addressed. And you can share that with your buddy or a support person if you have someone. And if you are uncomfortable for whatever reason with talking about your trans or non-binary status, you may want to write that down or have some documentation so that you don't have to do that work every time you go along to a new health professional to explain that. So give that documentation to, it may be something you've written yourself or something that others have written, like a doctor or something, to the health professional so that they can read it, do that work themselves, and then come to you. So that could reduce the burden on you as well. So those are just some basic tips for trans and non-gender, non-binary people. And that's also, I guess, because my aim is to talk about and to health professionals more here. These are things that you would hope and could suggest to your trans or non-binary people to do when they go and see other health professionals, or the next time they come to see you. This could help them feel more comfortable in that context. So now moving on to health professionals doing the work. Oh, I forgot there. So do remember, even though this can be difficult and challenging to create those boundaries, that you don't have to disclose or discuss anything that you don't want to as a trans or non-binary person. And it's okay to leave if you're not comfortable. So I know trans people that have walked out of healthcare appointments. This is a perfectly valid thing to do if you're not feeling comfortable for whatever reason. It should be the responsibility of the health professional to help you feel more comfortable in that space. Health professionals should know that trans and non-binary people have often been marginalised in healthcare settings and other kind of formalised settings. So it is not surprising if people need to take some space from it for whatever reason. So there has been some work in the physiotherapy space around transgender bodies, but really almost none. So in the Australian context, Megan Ross and I are starting to develop a resource for physios, which is upcoming. And Dr. Megan Sharp has looked at how it's taught across healthcare settings, and particularly the physiotherapy settings in Australia. But again, her work is still not as yet unpublished. And Megan Ross and I will be talking about some of our work in this presentation. In the Canadian context, there's some physiotherapists and allies who are discussing trans issues in the context of physiotherapy. Again, not much research on that yet, but there are some very constructive conversations which include trans voices happening in that situation. And in the UK and Norway, there's a couple of PhDs that have looked at gender in physiotherapy, not specifically looking at transgender, but certainly some of it addresses non-binary gender and addresses the way in which we gender ourselves as a profession, what's seen as normal or normative in terms of our professional gender identity, which is an interesting topic. And globally in physiotherapy, World Physiotherapy is the name of our international organisation. There's a number of researchers there who are starting this discussion, including me, on transgender and physiotherapy in the context of diversity and inclusion and anti-discrimination processes. So there's a number of things happening around the world. And Dr. Uchenna Osei, I want to particularly call attention to her work. The one with the great red lipstick and cool hair, short hair. She's doing a lot of work in terms of in pelvic health and physiotherapy, so working with a lot of trans women particularly in that space. And that is actually where quite a bit of the physiotherapy conversation around trans health is cropping up actually, and I'll come back to that a bit later. So there is some work, not much of it's published. These discussions are starting, but they're very, very few and far between. And we do need more work in this area. So I wanted to bring into mind the thought of physiotherapy for you. Some of you may be physios that are listening to this, and I've given this presentation to the Australian Physiotherapy Organisation, or a version of it. But yeah, physiotherapy, this is a Google image search for it. Yeah, many of you may have been to a physiotherapist, or you are one yourself, as I was saying. But this is what comes up and I think comes to mind when we think of physiotherapy. It's a particular type of person. You can see here that people are kind of sporty-ish looking. They're wearing kind of active wear. It's quite white. So in terms of skin colour, there's a lot of whiteness here. It's another issue that's being considered a lot more in the context of physiotherapy, a very important one. And also in terms of gender, you can see that the men are kind of masculine looking and the female are stereotypically feminine looking, with hairs tied back in a ponytail, maybe sporty feminine looking. So maybe a little variation on feminine, but still fairly binary in their gender. The men look like men and the women look like women. So there's not much visible space for non-binary people in this context, and certainly no visible recognition of transgenderedness in this context. So what matters about that is that some people feel more welcomed into this space than others. And I'll come back to how LGBTIQ people, and particularly trans and non-binary people, feel in the space of physiotherapy from our research. But why would we bring this up? Why does it even matter? Should not all people just be treated the same and respectfully? Well, we do know that trans and gender diverse people, I'm not going to harp on these negative statistics, but we do experience greater barriers to healthcare. We do experience suboptimal care, feeling judged or being judged, discrimination by health professionals. And as a result of this stigmatisation, not because of our status as transgender or non-binary, because of this discrimination, we experience significantly poorer physical health, significantly poorer mental health, and certainly much higher suicide rates than the general population. So this is my points that I've made here are based on a lot of research across healthcare professions, but really this has only been very recently investigated within the context of physiotherapy, with ours being the first paper that we know of, and so far the only paper on this topic specifically in our profession. So I'm going to share the results of that paper. The experiences of physiotherapy by people who are trans involve experiencing assumptions about their gender, discrimination, mainly implicit but sometimes explicit discrimination. There's some issues around the proximity and exposure of bodies, so being close to other people's bodies and undressing or being observed, that is typical of the physiotherapy context. And there's a lack of knowledge around transgendered and non-binary people's life experiences, and also treatment needs in terms of physio-related care. So what I'm going to talk about today is how physiotherapists and other related health professionals might demonstrate a lack of assumptions to address this issue, how we might avoid perceptions of discrimination as well. And I didn't say this at the beginning, but as well as being non-binary, of course, I'm also a physiotherapist. So I'm talking about myself. When I say we, sometimes I mean we as non-binary or trans, and sometimes I say we as a physiotherapist. I'll try and be clear about that as I go on. So yeah, I'd like to talk about how physiotherapists, we, might avoid perceptions of discrimination around trans and non-binary bodies in our context. And in terms of proximity and exposure, so that closeness that we have with our patients as physiotherapists, to develop an awareness of the issues that trans people might have around this proximity. Not all do, but some do, and a respect of people's physical boundaries and emotional boundaries around this. And in terms of knowledge, and this will be the least of my focus today, is what learnings that that physiotherapists need in this context, and sort of how to manage this lack of knowledge as well. In terms of assumptions, this is from our research with non-binary and trans people who have been to physiotherapists. They said that the physiotherapist assumed I was a cisgendered heterosexual girl every single time. That's the default until I explain. So cisgendered, for those who don't know it, and I'll come back to this again later, is that your body aligns with the assigned gender that you were given at birth. So that's different from being transgendered or non-binary. Those people, we, aren't cisgendered. And you can see here every single time the frustration. This was actually a survey, so this is how this participant actually wrote this. It's very frustrating for this to happen. It doesn't make someone feel comfortable when they have to go through this every single time. So you can see this sort of discomfort. And as health professionals, what we want to do is make people feel comfortable in our spaces. So this is working against that. It's not a healthful space when people are coming in and not feeling comfortable, feeling marginalised or stigmatised. It's not going to help them improve and get well. We know that. So how might we demonstrate a lack of assumptions? It may not be that this physiotherapist had assumptions, or these physiotherapists that participant was talking about. But we need to demonstrate that we don't have it, because we're used to, as trans and non-binary people, having these assumptions made about us again and again. So some ways in which we can demonstrate it as physiotherapists or other health professionals is to use people's preferred terminology for their gender. Generally, you might use non-binary terms, so they or their, for example. But if you're asked to use binary terms, then you must use this as well, because sometimes people do not want to be non-binary, particularly if they've transitioned. So they've transitioned to a particular gender, so they would definitely want then for you to use he or she, depending on what their transition has been. So some people think that they, there is appropriate for transgender people overall, but not necessarily. So use what is asked by your participants, your patients, and ask in the first place. So if you put open answers for gender on your forms, people will be able to choose what they want. So it's not just he or she as the options. And you can also ask for preferred pronouns if you want on forms. So this is something that's at this point rare in physiotherapy to do this, but particularly if you're working at a clinic where there's a lot of trans and LGBTIQ patients, this is a very important thing to include, but I would argue that it would be helpful to include anywhere. Another way to demonstrate a lack of assumptions is when someone discloses or comes out, I guess, to use a word from the LGBT community. So when people disclose about their gender, they come out to you, they share this. This is a really important moment. It's usually a sign that someone is either trusting you, which is great, or testing you, testing to see if they feel safe, or they've had to do it. And it can be a very hard moment if that's the case. They've had to do it because it's important to their care. So it's a very important thing when someone discloses to you. That's a great moment, actually. So to make this moment go well, obviously just listen and don't react with shock. Most people, I don't think, would do that. But another way to make it feel safe for people is to return to this disclosure in a non-invasive way. This sort of normalizes it and makes the trans or non-binary patient feel that you can talk about this issue. So sometimes people bring it up and then it's never discussed again. It actually feels unsafe if that happens. So do return to it in a normalizing way. So you may ask questions that are relevant to the presenting condition. Avoid over-interest. So don't return to it asking questions, particularly about whether you've had surgery or not, something like that, whether you're taking hormones. That, if it's relevant to the condition, then absolutely bring that up. But if not, I would avoid that, because people often experience over-interest, and that's a form of discrimination. So use it in the terms of less confronting topics. Another way to demonstrate this is about the benefits of demonstrating this lack of assumptions. So basically you're establishing a safe and non-threatening environment for the trans or non-binary patient that you have. This reduces their anxiety. It's such a relief, actually, when you can discuss these things and people are fine about it. And it does open the door for future disclosures. So if people need to, even if it's not relevant to their condition then, they may be able to discuss their experiences in the past and that they've had in the past that may become relevant later, or that they didn't know was relevant to their existing condition. So this is makes these future conversations much easier. Potential pitfalls about it is that having these discussions can feel awkward at first. So you may not be able to normalise it so easily to start with, but it's better than avoiding it, and it does get easier with practice. Particularly things like asking for people for their preferred pronouns. This can sometimes surprise non-LGBTIQ plus people. And that's okay. And it's not going to be a surprise for someone who is trans or non-binary. So sometimes it will be a surprise for people because they're used to heteronormativity. So do be ready that it will surprise some people, but it's something you can just move on from with them. Another way in which you can make a safer environment for your trans and non-binary patients is to display what's called allyship. But I have to put a caveat on this. Allyship is not something that you can determine for yourself. It is a long-term ongoing commitment to supporting the trans and non-binary or LGBTIQ community. You can only really show allyship, or you should only show allyship if you have the expertise. So if you're unsure, if you feel like you're an ally for the LGBTIQ person or for the trans person, perhaps ask some of your trans and non-binary friends if you think that this would be appropriate for you to do. And if you don't have any trans or non-binary friends or colleagues, then perhaps it's not quite the right time for you to display allyship. So if you can, if you are in a position to display allyship, then you can show a rainbow or trans flag. Those are at the bottom of the slide. You could explicitly state that your clinic welcomes LGBTIQ plus people or offers a trans and non-binary specific service on your website or other advertising materials. And if you want to become an ally, one of the steps you could take towards this would be to undertake allyship training at University of Queensland. This is available. You can find it on our website, and it's available at many other institutions as well. And this is a great experience for many people. So the other thing that we found was discrimination amongst physiotherapists. So this is the experience of trans and non-binary patients coming to physiotherapy. So some experienced discrimination. Like I said before, most of it wasn't overt. Most of it was much more subtle. So that overt stuff, I think, is transphobia or inappropriate attention is relatively easy to manage and hopefully particularly rare, but I'm more interested in discussing these much more subtle forms of discrimination. So one patient said, despite repeatedly stating my gender and having my gender legally recognised as male and listed as male in their systems, I was referred to as female and she, her by the physiotherapist. So this is discrimination. Repeatedly stating your gender, having my gender recognised as male, enough information about being male, and they kept being referred to as female. This is definitely discrimination. So if someone corrects you on their gender, you've made a mistake, that is okay. But repeatedly doing it is discrimination. So absolutely shift and change. And it is okay to make mistakes. We all make mistakes, and trans and non-binary people, we can, we're okay with that. We're used to that. But repeatedly making it is not okay. So use respect for language to avoid perceptions of discrimination. Use the preferred pronouns. If corrected, then apologise, and importantly, change. Write it on the forms, whatever it takes for you to remember it, do that. That's your work to do it. Avoid over-interest, as I was saying before. So only ask questions relevant to people's trans or non-binary status if you need to, and or in ways that are non-intrusive. Be aware, as a physiotherapist, often you might ask people to disrobe, take clothes off. So be aware that people may be wearing body contouring garments. So trans people may use these to shape their chest, to make it more feminine or masculine. And do not ask people to remove these unless essential and consent is gained. So you have to be very careful regarding this. This is very essential to how people feel about their own bodies. It can be very traumatic to remove these body contouring garments. So try and be as flexible as you can, be as versatile as you can. We're used to doing that as physiotherapists. Don't remove it unless essential, and be very cautious if you do need to remove it for whatever reason, how that is done, and gain consent. And I've just got a reference down there, the CSP, which is the Canadian Physio Association, which talks about, sorry, not the Canadian Physio, the British Physiotherapy Association has some really interesting discussions about that. Usually I talk with physiotherapists about gender. This will be for anyone who's trans or non-binary out there, probably some really simple stuff. But for a lot of people in physiotherapy, they haven't encountered this very much. Just so very, very briefly, gender identity, expression, and biological sex are different things. That's very much how we consider it here at UQ these days, and is the generally accepted and respectful way to think about gender and sex. And who you're attracted to really has nothing to do with any of those. So gender identity is how you identify in yourself. It's something between womanness and manness, somewhere along that spectrum. It's not considered necessarily to be binary, although some people are comfortably in either ends of those spectrums. Gender expression, so that's how you are. So gender identity is like an internal sense that may or may not be expressed externally. So the gender expression can be masculine or feminine, butch, femme, hypermasculine. There's lots of ways to describe that. So people express themselves in different ways, more masculine or feminine. That may or may not relate to your femaleness or maleness. So those can be quite different. So biological sex is also not considered to be on a binary scale these days. So people may be more female or more male or a combination. They could be also asexed or agendered. So we have a whole range of options these days, and things are not necessarily considered as binary as is traditionally or commonly thought about. And again, like I said, who you're attracted to generally has very little to do with your gender or sex. So they can be completely separate. Sometimes, unfortunately, people confuse sexual attraction with your gender, but that's not the case. Some terminologies, some very basic terminology. There's a lot more, and terminology changes all the time. So some of the things I say here will feel comfortable for some trans and non-binary people and not for others. Cisgender, as I mentioned earlier on, is a person whose gender identity and biological sex, which is also a bit of a funny term that's not entirely acceptable, but it's the sex assigned at birth, that these things align. So many people fit into this. Their gender identity and their sex that was assigned at birth seem to align. This is not the case necessarily. This is not usually the case for transgendered or non-binary people. So the gender binary is this concept or belief that there are only two genders, and that one's biological or birth assigned gender will align in this way, as with the cisgender person, with traditional social constructs of masculinity and femininity. So that's the gender binary that we're talking about, and that trans and non-binary and genderqueer, etc., people don't fit into. Gender identity is, as I was mentioning, the inner sense of one's gender, which could be either both, or moving around freely between or outside of the gender binary. Gender fluid or genderqueer, it's often expressed as, is a person who does not identify with a single fixed gender, or who has a fluid or unfixed gender identity. So I sit within that concept of not identifying with a single fixed gender. Intersex is people who are born with physical, hormonal, or genetic features that don't fit medical norms for female or male bodies. Misgendering is referring to a person in a way that does not reflect their gender identity. So I gave an example of that before, where someone who was misgendered as female when he identified as male. And non-binary is not identifying as either male or female, like me. A transgender person is a person whose gender identity and sex assigned at birth do not align. So these are sort of basic definitions of some of the terms. There are many more as well. And I've sort of gathered these together from a couple of different sources there, which I've cited at the bottom. If you want to look into this a little bit more, those are some sources. So gender. There's some terms there, and when we did this survey of, it was over 100 people who'd visited physiotherapists in Australia who identified as LGBTIQ, so lesbian, gay and bisexual, as well as non-binary in their gender. These were some of the things that they identified as. So physiotherapists out there are people identifying with a whole range of things that could be considered on the sort of female end of the spectrum. This is what they put in the open form for what you identify your gender to be. Male to female is the M to F there, so that's transgender, and female, all these other different terms. And then non-binary, fluid, trans, genderqueer, and then so more on that sort of non-binary or transgender spectrum. And then there's a number of different masculine identities as well as agender. So these are patients of physiotherapy, physiotherapists, and this is how they identify when we freely give them the option and give them a safe space, because we said that we were queer ourselves, to identify their gender how they want. So this other point that I was coming to early on in the slide, this is the second last one. There's this one and one other thing to discuss. So this was about, in the physio context, obviously, we have close bodies. So the physiotherapist often being very close to the patient. Physiotherapists do use stethoscopes, by the way, for particular things. It does look a bit more like a doctor in this slide. But maybe that's just a stereotype of how doctors appear, but we do a lot of respiratory physio, so we use our stethoscopes for that, amongst other things. But yeah, so there's an exposure of bodies. Bodies get observed and looked at. We take notes, like this physiotherapist is here. We watch people walk. We watch people semi-dressed walking, and we touch bodies. We're very physically close to bodies quite often as physiotherapists, even in current COVID times. So we need to, in this case, consider that people with trans bodies may and frequently perhaps do experience some discomfort around their bodies due to a gender dysmorphia, perhaps. So feeling a discomfort and disjunct from their body because it may not represent their internal sense of gender. And they may also have experienced abuse, which is actually quite common in some transgender populations. So show awareness and respect of these boundaries. It's a really important thing to do. Sometimes we might, in order to show this respect, offer other options. For example, partial undress, treatment through clothes can be really helpful. We need to ask for informed consent, but there are sometimes when there's more power issues or there's more discomfort, we need to be particularly good at asking for informed consent. So you may say something like, I often use treatment X for this, and that involves doing Y. Are you comfortable with that? There are other options. So putting this, the power in the hands of your patient in this case. And something that I also work with the physiotherapy students to do a lot is to show some hesitancy and gentleness. This kind of shifts the power dynamic. It shows that you're not just the expert that is going to tell the patient what to do. I think physios can have this characteristic, but sometimes we can be kind of a bit macho and jocular and kind of joking and as well. So I think in this context, we need to bring out this kind of gentle, hesitant side, and that can help a patient feel comfortable to state their own boundaries if needed. And the final thing that I'm going to talk about is the lack of knowledge in physiotherapists. And this is something that our trans patients who filled out our survey mentioned a number of times. So this trans patient said, I felt like it had nothing to do with anything, and I felt like they were being invasive about my personal life. So this was in the case of a physiotherapist asking them questions about their trans identity and experiences. So we want to avoid this sense of over-interest and this feeling of being invaded about this. So in this case, really consider what you need to know. I did mention this earlier, and if you need to know it. Don't put the patient in the role of the educator. if you need more information, or if you think you might need more information, find out about it another way, or at least be very respectful and considerate about the way you might ask. Do you think this is relevant to the condition, or whatever? And what to learn? What should physiotherapists learn more? So I've already mentioned language. This one's really important because it does show respect. So learn that, practice things like asking people for pronouns, practice that at home. It might feel awkward at first, but give that a go. Also, please be aware of the processes of transitioning. There are many programs on this available on television. You know, things, thankfully, there's a lot more information about that. So there's some great places. Go and watch some great shows on ABC TV or SBS. There's some fantastic shows about what it's like to experience transitioning. There are some great questions, what not to ask about transitioning as well. But do be aware that really it's a very long, often arduous process with multiple medical appointments involved. Some people may not go through any medical intervention at all, though, like me. So it may be that some people have not had those lengthy processes as well. But for many people, particularly people who are going through a full transition, there's multiple appointments that checked everything with psychiatrists, GPs, other specialists, many appointments. It takes a long period of time. Things like surgeries are expensive, time-consuming, invasive. So it is a long process. It just doesn't happen like that. There's all the process of coming out. There's all sorts of things. So be aware of this complex process. Do some research. Find out some more about this. There are many gender-affirming non-surgical practices. So there are things like retraining and shifting posture. There's binding, so tight garments to flatten the chest for trans men or non-binary people. Things like bodybuilding can change people's body shapes. And of course, hormones as well is one that's more known about. Just as an example of something that does relate to physiotherapy practice, binders can have an effect on people's health, but many people don't know about them. So they're a restrictive garment. They can be made out of all sorts of materials, can be cheap or expensive, and they provide a safe, relatively safe alternative to some more potentially harmful practices, which you should be aware of as a physiotherapist to warn people against. So you can wear a double or backward sports bra, you can wear compression shirts as well, or folded tank tops, stretchy tank tops, which will also flatten the chest. The reference at the bottom is a specific discussion about this for physiotherapists. But you can give your patients tips about safer binding, because you can imagine this tension, this tight garment across the chest can cause some issues with thoracic mobility, so the mobility of this part of the spine, and can affect people's ability to breathe comfortably. So we shouldn't suggest that people don't bind, because it really has major psychological implications for people's feeling and sense of self. But we can give tips for safer binding. So things like binding less than 8 hours a day, removing it before sleep. Do not use these unsafer alternatives such as duct tape, or gaffer tape, we call it in Australia usually, or bandages. And if it stops, hurt, and find an alternative or seek advice. We can help people by getting their spines moving and teaching them deep breathing exercises to work better with a binder. And this information that I've got has come from a talk that I gave with those Canadian physios that I mentioned at the beginning, so I thank them for that. Beyond that, there are gender-affirming surgeries. So I'm not going to go into this in a lot of detail, and if this is relevant to your practice as a health professional, then do find out more about this yourselves. But just to be aware, there's chest surgery or top surgery, which is similar to a mastectomy, but we don't tend to call it that because it's not so relevant in terms of the gendering. So you generally use the terms that the patients would use, so top or chest surgery. So this is for female to male transgender, breast augmentation for male to female transgender people going through surgery. Of course, as with any surgery, there are the usual complications which are possible. In some ways, these surgeries aren't particularly different from those that cisgender people would experience in the case of mastectomy or breast augmentation, but we need to be careful with our language around it because it can be quite different. For men who've had chest or top surgery, so female to male transgendered patients, there's scarring that may need some physiotherapy work to release the scar tissue, and also often female to male participants want to start training to increase their muscularity, so they'll be wanting to know things like how long until they can return to that type of activity. Pelvic surgeries can be used for both female to male and male to female transgendered patients. So there's gender affirming phalloplasty, which is very unusual in Australia. In fact, most people have to go overseas for that surgery. And it's actually the same with vaginoplasty, although there is a surgeon in Melbourne who does that. Hysterectomies are often common for trans men because of the hormones they're taking. This often hysterectomies may need to be done as well for safety reasons. And just to be aware that while again these surgeries may not have anything additional to the pelvic surgeries that we might treat, there are some specific practices that are important to learn for transgender people, and the language is important to learn. The availability and the type of procedures really do vary by state and by country, and be aware that this is often a very costly, time-consuming and often quite traumatic process for, and often quite liberating as well, process for transgender people to go through. You can see more details about this if you're a physiotherapist on the Australian Physio Association's CPD for Physios talk, which is about understanding trans health by sexual health physician Dr. Sally Murray. So that one can give you a little bit more information about this if you're relevant, if it's relevant to you. But I don't want to go into it because again, there's that over interest thing. So only if it's relevant to your work, you should investigate more about this. There's one study which talks about the effectiveness of physiotherapy in pelvic health, and that's Jiang and Gallagher there. So you can check that one out. So this is kind of the end of my talk overall, although I will provide some more resources at the end. I wanted to return to these tips for visiting physios for trans people. So despite having gone through what I have just gone through, most people's experience that they reported were quite positive. Physios can be really supportive, sometimes even transformative for trans patients. It can be a very positive space for people to go into, and physios can provide a very safe environment, but sometimes it can also be marginalising, and people can feel unheard as well. So if your physios listening to this, let's work towards you being one of those physios that can really support people and make them feel good being who they are in their lives. If you're a trans patient or a non-binary patient, then you may have some great experiences, but just be prepared with these tips that I was reminding, that I brought up at the beginning. So just to remind you, ask others for recommendations, shift the power balance where you can. So take a buddy or support person, write down your questions so that you make sure that they get answered, and bring documentation so you don't have to do all the work to explain your gender. This will reduce the burden on you. Remember, you don't have to disclose or discuss anything you don't want to, and it's okay to leave if you're not comfortable. Find someone else. So overall from this talk, the take-home messages for health professionals are, and for trans people are, to assess your health professionals on, a health professional should demonstrate a lack of assumptions using respectful language by doing things like changing intake forms so they're aware of people's preferred pronouns or gender identity. You can, if it's relevant, as a health professional, display signs of allyship, but only if you can actually be a true ally. Understand as a health professional what discrimination is and avoid doing that. be gentle, flexible about undress and other forms of bodily exposure, and learn about LGBTIQ plus experiences, particularly in this case we're talking about trans and non-binary or genderqueer people's experiences and health issues, but avoid over-interest. So today I focused on patients and clients of physiotherapists, but we also do need to consider creating a culturally safe environment for trans and non-binary physio students and physiotherapists, so our colleagues, me, and intersection with other characteristics is also really important, and I haven't discussed this much. So different experiences across cultures, rural and city, all these types of things are really important as well. So I'm going to leave you with a few resources for physiotherapists and patients of physiotherapists might be interested as well. This is a paper that I wrote on stigma in physiotherapy, how we might be stigmatising, a little bit related to that Google search image of physiotherapists that I brought up at the beginning. There are education resources to work for being more inclusive and a better ally, and gender and sexuality specific ones, including that genderbread person that I put up earlier. There's an education resource, I think the only one that I'm aware of, specifically for LGBTIQ people. It's a video and physiotherapists, so it's a video made by physiotherapy students in the University of Melbourne with an older lesbian community, but which also includes a trans woman as well. So that's got some interesting resources there and a great teaching resource I've found. That's the paper that I was talking about today. And there's also some diversity training if you're interested in doing that. So thank you very much for listening to this talk today. Please do get in contact if you have any questions about this. And thanks for listening.